All right, so today we're going to talk about resilience, and I'm I was pretty consistent with Jamie and with Sandy about like let's just keep the title as resilience because I wasn't entirely sure when I started pulling this together what direction I wanted to go in. And part of that is because obviously resilience is something we've heard about for a long time. It's something that we want to foster and make sure that we're boosting in individuals. There's been lots of research on why some people are more resilient than others. But then we heard a lot about resilience during the pandemic, since the pandemic, and certain communities have certainly heard a lot more about it than others. And one of the things that I've heard more and more is kind of a pushback to we can't continue to ask people to constantly be resilient in the face of things that are just blatantly traumatic. Um, some things are very normal responses. So because it's a little bit of all over the place, it starts to make you wonder, like, so is there something tremendously special about resilient people? Do they cope really well? Does it mean I'm failing if I'm not resilient? Maybe there's something wrong with the resilient people. Are they, just denying or stuffing their feelings? Um, but I guess the evidence actually shows that resilience is the norm. It's the most common thing. So that's what I decided to focus on a little bit today, just kind of that counter narrative to resilience doesn't mean just one thing or one thing to any one person. So what exactly is resilience? It is not just the absence of dysfunction. So the American Psychological Association's Dictionary of Psychology defines resilience as the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, or behavioral flexibility and adjustment to external and internal demands. A number of factors can contribute to how well people adapt to adversity, including things like the way in which individuals view and engage with the world, availability and quality of resources, and specific coping strategies. An article that I referenced, actually the article that got me thinking about doing this didactic overall is the one by Bonanno, Westphal, and Mancini. So I will reference that one quite a bit. And they define resilience as a pattern of generally stable, healthy psychological and physical functioning following a potentially traumatic event or some type of a loss. So their research really focuses on the resilience after some type of thing, whether that's a death of somebody that's very close to you, some type of a loss in another area, or a potentially traumatic event. They do point out that transient mild disruptions to functioning are going to occur even in the most resilient individuals, but that resilience is an outcome pattern state that's really characterized by that stable trajectory. And while research demonstrates that resources and skills are associated with greater resilience, that it kind of can be cultivated and practiced. The strongest evidence is that most people respond pretty well under even the most extreme stressors with minimal disruptions in their overall functioning. So that's what this graph shows. So this is the commonly observed prospective and longitudinal trajectories of responses to potential trauma. And it was adapted actually from a 2004 article. So in here, you could see the common trajectories. So, over the course of time, you've got before the potentially traumatic event of that PTE, and then after the potentially traumatic event. And then you see, on the other axis, there's going to be the health and dysfunction. So resilience is actually the vast majority of people. Most people fall in that line. Recovery on this means the pattern that shows some elevated symptoms and impairment after the event, followed by a gradual return to baseline. Chronic distress is really those people anywhere between 5 to 10% of individuals exposed to some type of potentially traumatic event. But that's where people are they're experiencing that chronic pathology and landing it's for like long-term PTSD kinds of symptoms. There are also delayed reactions shown on this. And so that is where there's maybe some sub-threshold symptoms and it looks like they're getting worse over time, but they actually did have some symptoms right after the event. It's just that they weren't really showing up so much. They've just continued to worsen. Two other trajectories that weren't on that original graph are continuous distress. So these are the individuals who really had symptoms before and after a traumatic event. So they're that kind of is their baseline, is to be symptomatic. And then distress improvement, which you could also look at as like post-traumatic growth. So some people might have some type of symptoms before a potentially traumatic event, but actually show improvement after. And so that post-traumatic growth pertains not just to restoring to like a homeostasis level, but actually increasing and improving the level of functioning compared to prior to the stressor. You know, some positive transformations. Those previous charts and descriptions were really about adults, where adults are shown to be, the most common trajectory is resilience. And in fact, that's actually the most common trajectory for kids too. And this article specifically looked at exposure to disasters. The stat that was not really heartwarming was that the UN indicates that children are the largest age group exposed to disasters. But in all of the possible ways that they reviewed the data across a number of studies, because this was a larger review study, they found that resilience really was the largest amount. So I don't know if you can see my mouse here, but this color bar in each one of these is the resilience bar. So everybody, there's going to be a portion that have some chronic recovery issues, some individuals who will show symptoms right after and then improve, and then some individuals who will be delayed, will have more of a delayed onset of symptoms. But overall, even amongst kids exposed to disasters, resilience is the most common trajectory. So what is resilience? Is it an attribute, some kind of a personality trait, maybe a process, or even an outcome? And these distinct conceptualizations of resilience actually can serve as a framework for going on how to measure it. So when you look at measurements of resilience, and there's tons of scales out there on how you can measure resilience, but each one of those really has to take a look at, do we want to look at it as multifaceted, or are they focusing in on one specific way of conceptualizing resilience? So when you look at any of the resilience scales, this is something to keep in mind. So that personality or attribute, it's really personality characteristics, dispositions, abilities that they're looking at. Sometimes this familial and social resources, they will kind of lump in there, some situational assets and other protective factors. Process is more of about those reactions, the coping responses, strategies, how an individual responds and self-regulates following a potentially traumatic event. And then outcome, so this one's kind of cloudy because it's kind of conflating the first two. It's conflating attributes and process. And it also just kind of assuming that people are always going to bounce back again. So some of the ways of looking at this can inadvertently lead to outcomes that we don't anticipate. So there's a hypothesized model of resilience, and this is by two of the same authors that I referenced in that 2011 article. But the way that they're looking at it is that there's, individual differences that are going to play a factor into this. There's also how, not only personality things, but beliefs, capacity for positive emotions, comfort with positive memories, but also how an individual is appraising something. And then there's like those extra resources, so financial resources, really kind of basic resources, thinking about Maslow's hierarchy, also some cultural beliefs and practices, so how much emotional support. In there, you also have coping, so emotional regulation, cognitive regulation, some behavioral regulation, and then potentially the outcome is resilience. There are certain things that we could look at that maybe are larger predictors of resilience, and so we'll look at a little bit of those now. And granted, none of these are any solid predictor. There's no way to predict if a person is going to be resilient post a loss or post event, or some large amount of adversity, because resilience in one situation will not predict necessarily resilience in another. But when looking at those who do demonstrate resilience, there are some things that correlate that they find as common factors. So hardiness. So people who demonstrate hardiness are those who kind of tend to appraise stressful situations as less threatening, thereby minimizing their subjective distress. They're also more confident and better able to use coping skills and social supports, helping them better manage the distress that they do experience. So things that you find within that realm of hardiness are being committed to finding purpose in life, having high perceptions of the self, feeling that they are adaptable and that they have some influence on their surroundings and the outcomes of events, but also understanding those things that they can't control. And so like I said, also having those appraisal of events is less threatening. Self-enhancement, so that's kind of a characteristic where these individuals engage in very positive, sometimes overly positive, and maybe even unrealistic biases in favor of themselves. So they see themselves as better than average, more so than the typical person does. And some of this can be a little bit off-putting, obviously, if somebody has a very high self-esteem and they think themselves very capable, to an extreme that starts to look a little bit off-putting to others, maybe even, into the narcissistic realm. But, it also can be a very positive way of engaging with life. These individuals tend to perceive their ability to cope as very high. They anticipate resilience, so they have a high sense of self-efficacy. They have a high sense of confidence and self-confidence, tend to have higher self-esteem and positive affect. They perceive also, like individuals with hardiness, at events as potentially less threatening. Following potentially traumatic events, they actually are shown to be typically more engaged with their social networks and are rated to be better adjusted by their close friends. And interestingly, in a 2004 article, they noted that they studied some cortisol levels, and their cortisol levels were even lower. Said the downside is that too much of this can be a little bit socially not the best way to engage others. So something to consider. Other things that can be predictors or common amongst those who demonstrate resilience is positive emotion and laughter. And specifically, like those who are able to talk about the loss or the potentially traumatic event and experience genuine laughter in that conversation. So if you think about if you've ever been at a funeral or talking with somebody who just recently lost a loved one and they're sharing stories, and at some point they start sharing a funny story and are able to laugh along with everyone about that funny story. So genuine laughter. Those individuals seem to do better longitudinally. Those with positive worldviews and are able to engage some cognitive flexibility. So can I think about how I want to think about this situation? Can I process it a little bit differently? Can I evaluate my negative thoughts and substitute some of the negative thoughts with more positive ones? Can I reframe this into something that maybe can help me make meaning? With the making meaning part, what's important here is that those that continually search for meaning but can't find meaning in a situation tend to not do as well as those who are able to actually make meaning out of it. So that the search for meaning can actually become more of a snake eating its tail process where people start to lose a bit of hope. Social supports are very important. Interestingly, what they referred to as repressive coping or delayed processing, while kind of just stuffing emotions down does not necessarily seem like the best idea. The research shows that people who do this do tend to very often handle, kind of bounce back to their baseline levels in a faster way. And some of it's kind of delayed. And if you think about Maslow's hierarchy, if you have to deal with how do I deal with, employment, food, just the more tangible day-to-day things, you can't necessarily think about how you feel about something until later. And then those tangible resources. So very interesting, like one of the interesting things that maybe we don't think about is if you have tangible resources, you can get to that emotional processing faster. So when they looked at following specifically Hurricane Katrina, those who were able to regain employment and regain housing faster were the ones who were showing, even if not necessarily on the resilient trajectory, they were experiencing recovery far faster than other individuals. So on that note, there are a couple things that make it more difficult to maintain resilience or to be resilient. Those with pre-existing physical illness and or mental illness had the highest symptoms following Hurricane Katrina, which obviously these are individuals who already needed some extra supports, and then having all of those supports taken away is going to be very problematic. And then resource loss has a really destructive impact on one's ability to bounce back from some type of potentially traumatic event. So whether that's job loss or income loss, so lower income by itself does not necessarily in any way predict resilience, but that loss, in addition to whatever the other stressors are, does seem to be something that makes it much more difficult for individuals. So can we bolster resilience? Maybe. What's interesting is that there's kind of a mixed bag here. So universal approaches have very mixed evidence, and it really depends on what kinds of things we're looking at in terms of universal approaches. So the critical incident stress debriefing strategy, which is part of a critical incident stress management model, has shown apparently no efficacy in reducing the likelihood of post-traumatic stress disorder. So much so that the American Red Cross, their advisory panel on first aid and disaster preparedness in 2010 put out a statement saying that you should not be using these as a universal approach following any kind of disaster. So in addition to it not being effective in reducing the likelihood of developing PTSD, for those who maybe aren't appropriate to get the debriefing, it might actually be harmful. So what we're seeing is that some of these universal approaches tend to interfere with the natural responses and tend to pathologize normal responses. So not useful in, as a universal approach. Related to that, the research on suicide and eating disorder prevention programs indicates that while there's definitely solid evidence for interventions that are targeted with at-risk individuals, so identifying those individuals through screening and then giving them some type of intervention based on them screening to be at higher risk, there's great evidence for doing that. Those are very effective. But when trying to apply a universal approach for either suicide prevention or eating disorder prevention programs, the universal application doesn't fare as well. For those who weren't otherwise at risk, some of the studies have shown that there's an increased sense of hopelessness and increased maladaptive coping. With the eating disorder one specifically, they actually saw an increase in dietary restriction. And so definitely not what we want to see when we're potentially making individuals think about something and then follow into a trajectory that they weren't on already. And then when you think about like workplace and community level efforts, a lot of those tend to they place the work of resilience on the individual, when in those situations, it's a lot of structural factors that are at play. So when we talk about like resilience with workplace and resilience versus burnout, so often the things are like, well, do some yoga and meditate and take breaks, but all of the things that are stressors with an electronic record and productivity standards and documentation standards, of the things that are actually leading to the increased stress aren't fixed. So those can be really problematic too. The flip side of this is that universal approaches, when we're talking about classroom-based interventions for younger kids that are focused on increasing the well-being of mental health and well-being of children, can be very effective. There's a review published in 2022 that also indicated that classroom-based interventions focused on certain things can actually enhance resilience of children exposed to adverse childhood experiences. So long as these universal approaches are doing things like focusing on increasing coping skills, creating feelings of mastery, so helping kids understand their locus of control, examining thinking and beliefs, encouraging pro-social behaviors, building social supports, and providing access to tangible resources like medical care, mental health care, dental care. Those approaches can be incredibly effective in kind of building that resilience early on. So kind of as a summary, resilience is very much the norm. And I would say more so than even thinking about it as the norm is that most of us are resilient. And we're resilient even when we don't realize that we are. Just thinking about resilience being that it's not necessarily that absence of dysfunction, but maintaining baseline. Regardless of the many stressors in our lives, we have some temporary disruptions, and then most of us manage to get back to where we were. So most of us are very resilient. But it should not be the expectation. There are very normal reactions to stressful events, to traumas, to lots of things in life, and we should not expect people to be resilient, because then that's just further pathologizing, further stigmatizing individuals. Some personal attributes can be helpful. Social supports, access to tangible resources can be very helpful. Interventions might be beneficial or not, depending on how we're applying them and who we're applying them towards. And those individual interventions are no substitute for addressing the systemic and structural issues, which I think we're all pretty aware of that. So here's my list of citations. Happy to, I don't know that I can answer questions per se, but I'm happy to have a conversation around any parts of this that are of interest. I also heard that we might have a case today. So if